Hi, my name is Dr. Robin Abramczyk, and I'm a holistic dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and today I would like to share with you about water. And a lot of people have the question, how much water should we drink? Kind of an old calculation that a lot of us refer to is take your body weight in pounds, divide it in two, and that's the amount that you should drink, but in ounces. So also another important thing to know is that water is the most important antioxidant in your blood, and in your bowel it's the most important functional laxative. So we want to make sure that we hydrate every day in the right amount. And a lot of people wonder, well, what kind of water should I drink? So we know that there are a lot of bad things in our water supply. For instance, chlorine, chloramines, fluoride, pesticides, fungicides, pharmaceuticals. These are really damaging, especially to infants, people who have damaged kidneys and liver. So we want to make sure that we're drinking the right kind of water. If you're out and about and you're not near a spring, well, one thing that you could do is buy Fiji. So you want to buy in the supermarket or in a convenience store water that comes from a deep artesian well. So one of my favorites is Fiji. Also Volvic is another good one. I also like these because they have a neutral or more alkaline pH, and that's really important in our water. So the more acidic our bodies are, the closer we are to disease. So we want to drink something that has more of an alkalizing effect on the body. So both Fiji and Volvic have either neutral or a slightly alkaline pH. Another important thing to consider is what kind of container you have. So if you are carrying your own container, I prefer glass, it's inert, and a second best would be stainless steel container. This is the one that I use, and I bought this at Target. So out on the market right now, there's a lot of misinformation about filters, and there are alkalizers and ionizers and also reverse osmosis. So an alkalizer, ionizer, they actually alkalize or change the pH higher, and that is something that we actually want. However, you don't want to alkalize too much. So my philosophy is we would like to mimic what is in nature. So ideally, you want to have it slightly alkaline. Highest I would go is 8.5. There are, if you're under the care of a physician, say a patient with cancer, that is one way that we can help bring health to a patient. So patients at the Hippocrates Center, for example, in West Palm Beach, Florida, the doctors there really alkalize the water up to an 11, but that would be under the care of a doctor. So if someone is acidic or they're toxic, actually drinking alkaline water can work as a detoxifier. But we want to be really careful about how alkaline we go. Again, mimic nature, about an 8.5 would be best. So if you do purchase an alkalizer, ionizer, I would set it slowly to 7 and then slowly acclimating it up. If you find that you're getting sick, you can have what's called Herxheimer or a healing crisis, so you want to be very careful on how quickly you titrate up. So another type of filter that's on the market is called reverse osmosis. That one is great. It actually has a filter or a membrane, and it removes a lot of the good stuff and bad stuff out of the water. So I did say that. It removes the good and the bad. So you want to make sure that you're getting the minerals that are removed that our body needs. So one thing that I just put a little drops of, this is called Trace Minerals. It's by Trace Minerals Research. It's called concentrates. So I just put this in my water, and I put enough where I can't really taste it, and that's what I do, and it actually creates an alkalizing effect. Another thing you can do is put a little lemon in your water, and that also has an alkalizing effect on the body. Thank you so much for joining us today.